Okay, so biomedical therapy does not just refer to psychiatric medication. Even though psychiatric meds are certainly the most commonly used biomedical treatment option, they're not the only one. So we're going to quickly run through a couple of other biomedical options, and then we'll be done with the chapter. So the next biomedical therapeutic approach is using something called electroconvulsive therapy. This is a form of brain stimulation, so it's a way of impacting the brain without surgically impacting the brain. And what electroconvulsive therapy does is it passes an electric current through the brain. This produces seizures within the body, so ECT does look pretty horrific if you see it being done because someone is seizing, and that's obviously something that's a little scary to watch. But the patient themselves, they're under anesthesia, so they don't feel any pain. It's done in like a doctor's office, and they're like strapped down on a bed. And even though ECT looks really, really barbaric, it has been shown to work pretty well for individuals with severe depression. So if we look, I'm not going to show you the video clip because you could look it up yourself, but you can find like a couple of different YouTube clips so you can see ECT being done. I will caution you, it does look a little bit like torture. The individuals aren't being harmed, but it is something that looks a little bit unsettling when you first watch it. So I will caution you, if you Google it, just keep that in mind. ECT was introduced in the 30s, and in 1938 to be exact. And what they did with the initial implementation of ECT was patients were completely 100% wide awake. They were strapped down their whole body to a table usually, and about 100 volts of electricity were just put through their body. Now, this early version of ECT was probably a little bit more painful and a little bit more invasive than ECT is nowadays. Nowadays, as I said, people are anesthetized. There's a general anesthetic that is given to them, as well as a muscle relaxant, because when you are going through a seizure, your muscles tense up and you can hurt yourself. You can suffer from muscle strain. And so what a muscle relaxant does is it makes the seizures not as dangerous. You don't have a risk of physical harm as a result of just the electric currents that are surging through your brain. After an ECT treatment, someone wakes up about half an hour later, and they don't usually recall what happened. There is often some memory loss for just the treatment period because of the fact that you're sending electricity through the brain. Some of the memories that maybe hadn't made it to long-term storage or were in the process of being consolidated, they oftentimes get knocked out a little bit. So there is a little bit of memory loss associated with the immediate treatment. However, despite this minimal memory loss, there really is no other discernible brain damage. Electricity just by itself, the way that it's introduced here, isn't dangerous to the brain. And as I said, ECT is a current treatment and a pretty successful treatment for individuals with severe depression. Obviously, it is something which not everyone wants to elect to go through. It can be pretty expensive. So before you try ECT, usually individuals will try cognitive therapy, maybe even Beck's cognitive therapy. They will maybe take a traditional antidepressant. But for those individuals for whom those options aren't working, for people who are severely depressed, possibly suicidal, ECT can be a last attempt to help them, and it can be successful. Why is it successful? Honestly, we don't really know. It's sort of as if, you guys know, sometimes your iPads just like turn off and then turn back on, and you get like the little Apple symbol and you wonder what's going on. Or sometimes your iPad just freezes up, so you just like reboot it. That's sort of what ECT is doing. It's rebooting your brain. And so just like your iPad knows, like sometimes it just has to restart in order to work again, like there was a little glitch and it's better to shut it down and start it up again. That's what ECT might be doing for your brain. It's sort of like restarting that computer, restarting that iPad. Another idea is that it can boost neurogenesis by sparking the electrical activity and spark neural activity. And so there might be some like neural growth that can happen, which can reduce some of the symptoms of depression. Uh, and as I said, ECT is very useful and very helpful for people with severe depression, and it has been shown to drastically reduce suicidal thoughts and suicidal ideation. But it is something that you tend to have to revisit every once or twice a year. It's not a one-time fix. It can work for a while, but then there often are relapses. And so often, if someone is severely depressed and ECT works for them, they will get it done maybe another time that year, maybe in like 6 months or so. All right. For those individuals who do not really want to undergo electroconvulsive shock therapy, there are some alternatives. There's something known as RTMS. Stands for, as you can see on the slide, repetitive transcranial magnetic stimulation. And what this does is, again, it's a neural stimulation. So it's still going to be impacting the brain, but here we're not using electrical currents. We're actually using pulses of magnetic energy. And what these pulses of magnetic energy can do is they can actually stimulate or suppress different parts of the brain and parts of and places of activity. This does not trigger seizures in the same way that ECT does. You don't have to undergo a general anesthesia for this to work. This is performed on someone who's just wide awake. And RTMS only really impacts the surface of someone's brain. It doesn't go all the way to the core. And for, again, sort of the same reason as ECT working, we are not exactly sure what RTMS is doing. All we know is that it triggers activity, specifically in the left frontal lobe of individuals who have depression. As we know, the left frontal lobe is associated with positive emotion and is often underactive or inactive in individuals with severe depression. So if you can sort of jumpstart that and kickstart it using something like RTMS, it has been shown to treat individuals with depression pretty successfully. And you can see in your textbook, you can see on the slide, there have been some randomized clinical trials which have supported the use of RTMS. All right, well, we've done brain stimulation, and now we get to the last biomedical therapeutic option, which is let's actually perform surgery on someone, specifically on someone's brain. Psychosurgery is rarely used. That doesn't mean that it's not used. It's certainly rarely used for things like depression or anxiety. Psychosurgery is really a last-ditch attempt to help someone because it is irreversible. It's going to involve the destruction or the removal of parts of the brain, and that's something that you can never undo. Once you remove part of someone's brain, once you lesion part of someone's brain, you can't just hit the undo button, and that's why it's something that is used very rarely. Historically, one of the most common forms of psychosurgery is a lobotomy. Lobotomies are not performed really anymore. There is a type of lobotomy that was very popular for a while, known as a transorbital lobotomy, and this was very popular. There was sort of a heyday of lobotomies where people actually there would be doctors who were trained in performing lobotomies, and they would drive from town to town in sort of like lobotomy mobiles where they'd have all of their supplies in the back of their car. They'd show up to a town, they'd set up shop with like a local doctor and say, I'm going to be here for a week. If you have anyone who needs a lobotomy, bring them in. Well, what type of person would need a lobotomy? People who had severe emotional behavioral problems oftentimes were lobotomized. And what a lobotomy would do is, without getting too graphic, and you can, if you want to know more about lobotomies, if you're queasy, I would definitely suggest you don't do this. But if you just go on YouTube and search, I believe it's called The Lobotomist. It was a PBS documentary that actually traced sort of the historical evolution of lobotomies by following like one of the most famous lobotomists. And I think YouTube has all of the different clips up for free. But what a lobotomy does is I don't want to gross anyone out. You historically would take something like an ice pick and you would put it in behind the eyeballs. So you'd have two ice picks behind the eyeballs and you'd have to kind of get through a little bit of bone. And then you take the ice picks and you'd swish them back and forth. And so what this back and forth motion would do is you would end up severing a whole lot of different neural connections, but specifically you would sever the connections between the limbic system, which would be down here, and your cortex and your frontal lobes, which would be up here. And so people who had severe emotional behavioral issues oftentimes lobotomies would certainly calm them down because no longer was their emotional center of their brain connected to their action center and their thinking center. And so even if they were feeling emotionally reactive, that wouldn't impact their behavior anymore. So people who were behaviorally out of control would become very calm often after lobotomies. Problem, sometimes they would be calm to the point of being comatose because, well, their brain was sort of very ineptly hacked apart. So there were people who were put into a vegetative state as a result of lobotomy. A lot of people died as a result of being lobotomized. So the intention of a lobotomy is let's disconnect thought from emotion. However, what the result of a lobotomy was at best someone who was alive but who was severely lethargic, sort of emotionally stunted at this point, reduced intellectual abilities, and at worst you ended up with someone who passed away as a result of lobotomy. So you don't see a whole lot of lobotomies being practiced nowadays. Some psychosurgeries that you would see practiced nowadays, I mean, there are removal of tumors. Certainly that's a psychosurgery that's done. We talked about split brain operations for people who have severe seizure disorder. Sometimes they'll just sever that corpus callosum so the two hemispheres can't talk to each other. But psychosurgery, as I said, it's pretty rare because it's a drastic intervention. All right, so we have reached the end of the therapy chapter, and your textbook wraps up therapy with a talk, with some talk about, in lieu of traditional psychotherapy, in lieu of some sort of biomedical intervention, what's actually needed is a lifestyle change. There are individuals who have noticed that the rate of diagnosis for every single psychological disorder seems to be on the rise, and that trend seems to be continuing and becoming worse. And so they say there must be something about our current lifestyle that is triggering all of these different disorders. Something about the way we're living now is so drastically different from the way we used to live, and it's something that's creating a lot of issues. And so a man by the name of Stephen Ilardi has proposed what he calls a therapeutic lifestyle change. And he says that we as humans and as organisms have been created for a very active lifestyle, that for years and years and years of evolution, we were individuals who were designed for physical activity, for social engagement, and we're no longer living in that way. So even though we were made to be outside, and we were made to be active and kind of, always in motion and like hanging out with people, we've become very isolated and we've become pretty sedentary. And as a result, we're now seeing all of these psychological issues. And so what Ilardi proposes and what some of his colleagues propose is that we just need to change our lifestyle. We need to be more active. We need to engage with more people in real time. We need to sort of stop living in our own little technological bubble, and we need to go back to the way that we lived sort of when we were hunter-gatherers, like way back when. And so there are a whole bunch of suggestions that he proposes as part of his, he has like a 12-week program. He says you need to get aerobic exercise, you need to make sure you're getting adequate sleep. Sleep is something we really struggle with, and as we know, if you don't get enough sleep, you see all of these issues happening. Light exposure, we said that there is light exposure therapy, and that is very helpful for seasonal affective disorder. Ilardi would say, let's just get outside. Let's just go outside more and play outside and have like social activities outside. Let's connect with people outside. He would say, once you're engaging in all of these activities, you don't have as much time to ruminate. Remember, we said rumination was one of the things associated with depression. And so if you are anti-rumination in your activity, always doing things, always being active, always talking to people, you don't have as much time to dwell on your problems. As well as he says we need to look at our nutrition and we need to really fuel our body in the correct way. So this brings us to the end of therapy. Hopefully you guys are ready for your test, which is fast approaching. If you have any questions, make sure that you email me and I will do my best to get back to you.